Well, I'm a clinical psychologist, and I've seen hundreds of people suffering from pain in the course of my work in pain clinics. What factors would I think of as being particularly important psychological markers of distress that maybe would become the focus of psychological interventions? Let me preface discussion of these yellow and red flags that are important to me with the observation that the sooner we identify these in caring for an individual patient, the better off we're going to be. I think that a psychosocial assessment should be a component of the first clinical examination of somebody suffering from persistent pain. Indeed, it should be a part of an assessment of somebody who has acquired an acute injury at work or in the domestic situation. I think that physicians and other healthcare practitioners could zero in on these very early in the game, because we know that these psychosocial factors interfere with the best medical management of people suffering from acute and chronic pain, and there are opportunities to intervene before the psychological and medical factors become more severe. In fact, we know that the longer somebody is in chronic pain, the greater the likelihood that psychosocial factors will become important in their lives. So I like to organize my thinking around people's emotions, their thinking, their behavior, and their social interactions with other people. And there are red flags in each of those four categories. In the domain of emotions, people who are very anxious, very upset, or who are depressed usually can be identified through a clinical interview or through a simple paper and pencil self-report inventory. There are a number that are available to primary care practitioners, so they should be able to use them. In terms of people's thinking, well, there are a couple of good paper and pencil inventories that get at people who magnify the extent to which their lives have collapsed as a result of pain, who ruminate on it excessively, who feel particularly helpless in dealing with their pain. As well, I hope you can appreciate the way I've described these, that frequently you can pick up on them in the course of a clinical interview. So that's the people's emotions, their thinking, their behavior. Well, we know that people who are frightened of pain will work desperately to avoid further bouts of pain. Often they don't appreciate that hurt doesn't always mean harm. They often feel that the hurt means that they're suffering from an irremediable or progressive illness that will lead to greater invalidism or even death. Often that thinking is preposterous, particularly when we're talking about chronic pain that isn't associated with terminal illness. It's very easy to distinguish between those who are suffering from serious illnesses that are terminal, cancer I'm thinking, but not necessarily always terminal. So that's the behavior and the behavioral avoidance that we want to prevent, and the inactivity which we want to prevent. Those are red flags for clinicians. Finally, the social interactions of the individual. Again, they're not that difficult to identify. Clinicians who ask people about their relationships with their employers, or talk about their relationships with spouses and family members or friends in the community, or continuing engagement in leisure activities that keep people going. So there are red flags in all of those domains that we can pick up through interviews, that we can pick up through relatively brief screening instruments. When we see the red flags, well, that's the opportunity to call on consultation from other healthcare professionals who might be able to engage in more intensive examination or provide referral to consultants who can provide some good treatment.